Manny Lopez. I'm one of the admissions advisors for Eastern's Office of Admissions over on the west side of Washington. And it is my pleasure to be able to moderate our academic webinar today for the College of Public Health and Health Sciences. So I have a wonderful set of panelists joining me today, and this is kind of how the format's going to go for today. We're going to have them all introduce themselves, share a little bit about the programs that they work in, the different programs and things that their departments or programs may offer, and then we're going to open it up to question and answer for you, the attendees, to ask of our panelists, really just to get to know maybe more about their programs, what they might be offered, how to get in, etc. So any of your questions, please make sure you include those in the Q&A below, and we will get to them during the panel. If for any reason we don't get to your question, please know that we're going to make sure we try to get all those answers out to you as soon as we can, and definitely reach out to us, connect with us, so that we can make sure you get your questions answered. So with that, I'll actually go ahead and actually ask our panelists to start introducing themselves, and I'll be going one by one so that they can introduce themselves. And we're actually going to start with Dustin Sem. Go ahead, Dustin.
Sorry, I was muted there for a second. I started talking. I told you all these great things about me. You didn't hear. I'm sorry. My position right now is the Student Success Coordinator for this college. And so the main part of my job is trying to understand how I can support students across disciplines. Sometimes you're taking classes from different colleges, different areas. If you're not familiar, a university has multiple colleges. So a College of Health Science, a College of Arts and Letters, a College of Science and Technology, and most of our programs have a few of those components in the process of getting to your degree and graduating and being a PT, a physical therapist, having a degree in therapeutic recreation, having a degree in athletic training. And so my job is really to focus on start to finish, how I can support you through the process from a systematic area. That being said, if you ever have any questions about how do I do what, I probably don't know, but I do know who does know. And that's my job, is to help you connect with the people like Jen, like Chadron, like Emily, who know what that next step is. So I am a professional middleman in the College of Health Science.
Thanks, Dustin. Definitely a great resource to have, and we're really appreciative to have you on our panel. Up next, I'll have Emily Messina introduce herself. Go ahead, Emily.
Hey, I'm Emily. I am the program director for the Therapeutic Recreation undergraduate degree. I'm also here representing two other degrees as well, Recreation and Tourism Management and Outdoor Recreation Leadership. So the three recreation degrees at Eastern all share a core set of curriculum together. I am the program director for Therapeutic Recreation, more of the clinical end of the recreation profession.
Wonderful. Thanks, Emily. Up next, we have Christie Brewer. Go ahead, Christie.
Okay, so I am Christie Brewer. I am the program director for exercise science, and within our program of study, we do have 4 different tracks. We have just a general exercise science track, and then we also house several tracks for pre-professional programs such as physical therapy, occupational therapy, and then also athletic training. I would just like to mention that we do have some opportunities for research within our program. We've had lots of students who either present at Eastern's Research and Creative Work Symposium, oftentimes presenting projects they do in our research and analysis class. We also have lots of opportunities to get involved in service, and I know Therapeutic Recreation also has lots of opportunities to get involved in service, but whether it's through our exercise science club, our pre-OT club, or even the capstone course, we've got some opportunities for you to do that. And then all of our programs require some sort of experiential learning, whether that's practicum, doing observation under licensed clinicians, or working in a clinical setting through an internship, or perhaps performance enhancement like strength and conditioning. So we have a lot of different tracks and things that you can go into with exercise science.
Wonderful. Thanks for all those options, Christie. I know students can't wait to hear more about them. Up next, we have Dr. Hazel Baker. Go ahead.
Hi, everybody. I'm going to share our website up in the chat. It's amazing. WAMS is Wellness and Movement Sciences, and we've got 7 distinct different programs, but even within those programs, some minors and some different tracks that you can go into. If you're into sports, you're into exercise, you're into wellness, you're into the wellness of others, you're into using sports, recreation, to heal, to help, we've got various programs. I talk to students all the time, and they're like, you can do outdoor recreation as a program? I'm like, yes, you can, and come hang out with us. My role, I actually am a little bit of a generalist. I do oversee our graduate programs in exercise science and in sport and recreation administration. But my primary teaching with undergraduates is I'm a little bit of a jack of all trades. I'm a certified athletic trainer and have done some classes in that area. I'm a certified strength and conditioning coach. I also work within the physical education and health. If you want to go be a teacher, advise and work within that department and teach, especially sports sociology, which is the study of sport and why it means so much within the United States. Do things like write Tiger Woods' name on the board and then talk about it for 45 minutes. It's pretty cool. Within that, we also have a minor in sports management that just launched this last year, blending a little bit of the business knowledge and a little bit of sports knowledge to have an add-on endorsement or an add-on minor. And we also have a coaching minor working with youth programs, learning best practices within coaching in order to help out and change the world of sports, as it were.
Awesome. Thanks for sharing, Dr. Hazel Baker. Definitely a warm spot in my heart. I'm a former graduate of a PE and health program myself. So just a good example of how some of these degree programs also can lead you to new and exciting opportunities. I still really utilize a lot of the stuff and the strengths that I learned in my program to apply to my admissions work today. So really grateful for all that we get from these programs. Up next, we have Dr. Sarah Mount.
Hi, everyone. My name is Sarah Mount, and I am Program Director for the Undergraduate Public Health Program at Eastern Washington University. And just going to try to stay within my 2-minute limit here, which is hard with this particular field. The field is vast. It's everything from emergency preparedness to disease specialists, or what we call epidemiologists, injury prevention, hazardous waste. There's a strong tie to urban planning. There is the opportunity to become a journalist if you like to write, or a lobbyist, public policy. It's a vast field. And so the program at Eastern is broad in scope to reflect that. And I wanted to share my screen with you so that you can see what I'm talking about. And don't let it scare you. It might look a little bit complicated at first, but it reflects some components of the program that I think are worth taking a look at. And I'm assuming we are up. Great. All right. So if you look at the junior year over here, we start out in a health disparities class because public health is founded on social justice. So we ask questions such as, how does social injustice impact our health? There's also an intro course, which is available in the summer if you would like to get a head start on the program. There's also another program course that's available in the summer, and that's our human sexuality. So if you're looking to get a head start in the program, summer's a great time to do that. And what you're looking at here are the core courses, because the program runs like on a cohort model, essentially. So a group of students start in the fall, and then they're together for 2 years. There are other courses that are in the program that you're not seeing here, but they're not considered cohort courses. They are offered more often. You can take them essentially any quarter, and those include courses like our exercise physiology class, public speaking, we have a nutrition course, but what you're seeing here are the core courses. And with each quarter, what we focus on, for instance, winter quarter, we go into theories, which is essentially asking how do we explain human behavior. This is our disease course, the epidemiology course. Spring, we start getting into courses that allow us to engage with our community and get us out producing products or participating in projects to assist our community. We do an environments for health class, which looks at how the built natural and social environments shape our communities. And moving right into fall here real quick and senior year, we do a social marketing course, which also includes program evaluation, where we try to figure out how we can use social media to promote change. And winter of the senior year is when students do their senior capstone, and we go in all sorts of different directions depending on what your career interests are. But that's definitely a time to get out into the community and help. And then finally, spring quarter of the senior year, a grant writing course aligned with your service learning, which is essentially an internship. And the idea there is that you learn how to write a grant or assist your community partner in your service learning in writing that grant. And that's all I've got in 2 minutes, although I probably went over, but feel free to ask me more questions.
Thank you, Dr. Mount. Definitely no need to apologize. If anyone's like me, I'm a visual learner and I'm a big fan of pictographs and being able to visualize everything that's going on, right? I think for a lot of the students, a lot of the attendees that we have with us today, it's a great tool to be able to see, well, I know junior and senior year are down the road, but hey, why not start looking at those options now and know really what I need or what I'm going to be kind of getting myself into and what it's going to take to earn those degrees. So thank you for sharing. I really appreciate it. Last but not least, we have Jen Goodwin. Go ahead, Jen.
Got it. Okay. Hi, my name is Jen Goodwin. I am the administrative side of public health and health administration. So we are a little bit of a jumble of a department, but I've got 3 undergrad degrees. So we've got health sciences or health services administration, and then I also have health services administration long-term care. So those are going to be the folks who manage health systems or work in hospitals, making some of the decisions, some of the higher up positions. So those degrees prepare you for that. The long-term care prepares you to sit for an administrator and training test, which is part of the leadership certification for if you want to work in long-term care or a nursing home. The other degree is a pretty exciting degree to us. It's called the Health Informatics and Technology Management degree. It's really a hybrid of HSAD and computer science. So you're taking some of those management skills you get being a health services manager and marrying them with some computer skills so that you are able to create some really neat health systems and learn how to track different health outcomes using computer information management. Within our department, we also have 2 graduate degrees. I have our Master's of Public Health degree, and I also have the Health Services Administration Graduate Certificate. So that's a little down the road for you folks, but it is something to think about. But I can answer most questions on any of the programs within our department. So don't feel like it's too soon to ask about graduate pieces or what you need to do. Even as a entry level like HSAD student, it's helpful for you to be talking with your department early so you know you're on the right track.
Awesome. Thanks, Jen. And once again, thank you to all our panelists for sharing a little bit in detail about what you do, the programs that you're helping represent today, and all the wonderful options we have at Eastern. I know for myself, getting to hear from all of you, I'm really excited for our attendees and to really provide a great set of resources and tools for them to kind of know, what is the College of Health Science and Public Health? What are the opportunities I have available to me, and what does it look like down the road? So thank you again. At this time, attendees, this is your action item time. So we really would like you to take advantage of our panelists and all that they have to offer, right? All that knowledge, and start asking some questions. So if you check down at the bottom of your screen, we have a Q&A section. That is there for you to ask questions of our panelists, ask them about the programs they offer, any questions that you might have really about the different programs they're representing. So feel free to ask those questions. Once they're on there, I'll be able to check them out as well as our panelists, and we'll kind of be going in order from first come, first serve in those questions. So please be patient with us. We might have a string of questions right away, and know that we'll get to yours as soon as we can. But please start typing away at your screen, your phone, your laptop, whatever it may be, answering those questions, and then we'll jump into it and have those answered for you. So we already have our first one. That one comes from Blake. And they would like to know, what is occupational therapy? And it looks like Dustin's going to answer that one for us. Go ahead, Dustin.
So I'm guessing, based on our panelists, that I'm kind of the OT person here. So occupational therapy, I hear a lot of questions from not just students, but people in general. What's the difference between athletic training, occupational therapy, physical therapy? Right. And so really what it comes down to is occupational therapy is, what do you do to occupy your life? Right. So that may be, how do you function in a work environment? How do you function at home when you have a certain different ability? So I can speak for myself. I have a permanent disability in my lower leg, and I've worked with occupational therapists to figure out how I can live my life for fun. I'm an avid snowboarder, skier, kayaker, stand-up paddleboarder. The occupational therapy helps me there. They also help me in, how do I function at work? How do I have a chair, a desk that helps me still be fully engaged in the world while dealing with my specific circumstance. And so an occupational therapy is really a degree that speaks to, what do you do as an occupation, not necessarily a vocation, right? So there's a very subtle difference there between, how do I occupy my life versus how do I make a paycheck? And those two overlap a ton. And so that's where programs like recreation therapy, programs like physical therapy also come into play. There's not a clear distinction between, is this a product of occupational therapy or rec therapy or physical therapy? But occupational therapy to me really means, what do I do with my day 24/7? And recreation and physical therapy allow me to improve my day within certain areas of the day. Oh, Emily.
I also wanted to build on what Dustin was saying. So again, I'm the program director for Therapeutic Recreation, and a lot of our students will come through our undergraduate degree wanting to go on to a master's in occupational therapy. So at Eastern, OT is a master's degree, and we have a lot of different tracks and opportunities for students at the undergraduate level to prepare them and meet some of those prereqs. And I'm sure Christie will hop on in a second, as exercise science also has an OT track as well. Recreational therapy, as Dustin mentioned, we work alongside occupational therapists and physical therapists. For me, the easiest way to distinguish between those three disciplines or those three professions would be, if I'm in a rehabilitation setting and I'm working alongside a PT and an OT and myself as a recreational therapist post-injury, that physician is going to set what that level of expectation for rehabilitation looks like. The physical therapist is going to kind of take lead on working on those physical goals, whether it be standing tolerance, mobility, strength, endurance, range of motion, building on that care plan from the physical therapist. The occupational therapist is going to work with that client on their activities of daily living, toileting, showering, cooking, cleaning. And then myself, my discipline of recreational therapy, we would then build on those same treatment goals, but do it in conjunction with that client's leisure habits and their recreational pursuits. So we would find out what they like to do, what makes them, what makes them, where their passion lies. And we're going to work on those same goals, whether it be standing tolerance, balance, mobility, but through the intervention that is a recreational activity. So that modality is going to look like whatever that person enjoys doing, whether it is tabletop activity like dominoes or gardening or an arts and craft activity. We're still going to work on those same treatment goals, but that intervention or modality will be a recreational activity. So we are one of the undergraduate degrees that does feed into some of those prerequisites for our masters in OT at Eastern. And I'm going to segue it over to Christie, as they also have a pre-OT track in exercise science.
Yeah, I really don't know that I can add a whole lot to that. I think Emily and Dustin did a really great job really talking about how encompassing occupational therapy is. Just a couple things that I could add to that. In our clinical ex-phys course, I teach a lesson on COPD. So for instance, an OT would work with a person who has, and that's a lung disease, a pulmonary disease, to learn how to move more effectively and more efficiently so they don't fatigue so much when they're doing their laundry or cleaning their home or grocery shopping, just basic activities of daily living, which they both touched on. I will jump in. There was a question about applying for the occupational therapy program. So I'm just going to jump to that next question. That was the second one that was up. I do have to remind you that I'm an advisor for the pre-occupational therapy program, which is different from the master's in occupational therapy program. So I can really just talk most about the undergrad program. You do have to declare as a pre-OT major. And now what that does is if you declare as a pre-OT major or a pre-PT major or a pre-AT major for that matter, by following our pre-professional tracks, that helps ensure that you meet the requirements for Eastern's graduate programs. So to declare as a pre-occupational therapy major, for us, what you have to have are 2 science courses. That's typically the first 2 human anatomy and physiology courses, or you can take a general chem and a biochem course. So 2 sciences, either the bios or the chems, and you need to earn a 3.0 or a B in both of those classes in order to declare. And we set the bar a little bit higher just because it is so competitive to get into those graduate programs. So 2 sciences with a 3.0 to declare as pre-OT, and then the MOT process is a little bit different. But by following our curriculum, you're checking all those boxes for the prereqs. And we also have a combined 3-2 program that I do want to mention. So 3 years working to earn your bachelor's in exercise science, and then actually starting the master's program your 4th year. So 3 years for an undergrad, 2 years for the grad degree. So it does save you 1 year of school.
Awesome. Thank you to the 3 of you. Wonderful information to share for sure. That last question that we had, I know the student was also asking in regards to observation hours. So they were asking, how do you provide support to your students when looking for opportunities to gain observation hours for most PT or OT graduate programs? Would anyone be willing to share a little bit about that?
Yeah, Manny, I jumped. Oh,
go ahead, Chad.
I jumped on that partly in the ties to the next question, looking at what kind of classes will be taken for the minor in sports management. One of the things that I appreciate about our programs is they are very hands-on for the kinesthetic learner. And so within exercise science, within AT, within sports management, we either have internships, field practicums, we have various ways built into the curriculum to help students go out and experience what they will be in the field. It's a way to give you some basic information and have you go out and practice it and develop it and look in those areas. So I apologize for stepping on whose ever toes were head that way, but we do across the board, our programs within our college set up help to be able to get you there. So for example, within the sports management program, you'll take accounting classes. There is a economics of the sport industry class. There's a marketing class. There's a sports law class or a risk management class. And there's also a sport sociology class talking about the role that sport plays in education and within our society. And then we also kick you out the door and say, okay, we've given you this tool set. Now go spend some time within the curriculum, completing an internship, completing hours out there, and see if this is what you want to do for graduate school and be able to apply those. And so PT, OT, across the board, we make sure that students are out there able to get some hands-on experience within those fields.
Awesome, thank you. Definitely lots of support, multifaceted. In fact, it seems like there's a lot of connection between the departments, the different programs, and the classes that students are going to be taking, and that one of the tie-ins for all of them for sure is the amount of support that students can have available to them, which is always great to hear. The next question we have is from Alexis. They would like to know, coming out of the Running Start program, which direction should I take to go down the physical therapy road? So really looking into the specific of any incoming student with a Running Start degree or Running Start credits. Is there any maybe particular path that they might be looking at going, and anyone would want to take a crack at?
From the global perspective, if y'all are willing to listen, I'll give you a bit of a big picture idea. And from PT, they honestly don't care what your degree is in, right? So to get into physical therapy, there's a handful of prerequisites, and those are physics and anatomy and physiology and things like that. Whether that is done through a sociology degree or an athletic training degree or a pre-athletic training degree, it is not that important. However, what has been seen is the students who go through the physical sciences side of things, exercise science, pre-PT, pre-AT, pre-OT, they tend to have a better understanding of the overall picture of what the degree is looking for. So if a student is really looking at progressing through a PT degree, which is a doctorate degree, which is more than what we're necessarily talking about right now, focusing on various aspects of exercise science tend to provide a really, really good foundation for understanding the next steps that are asked of the student once you get into the doctoral program.
Wonderful, thanks, Dustin. And for any students, I know myself, either if I was back in high school or even shortly after, right? You're going to be hearing a lot of acronyms. You're going to be hearing a lot of things thrown at you. So correct me if I'm wrong, everyone who's here, in case I miss on any of these, but the pre-AT is for athletic training, PT is for physical therapy, OT is for occupational therapy. The folks here are going to obviously be using those very eloquently, and so in case you were thinking, well, what are they talking about? Those are the different programs that they're mentioning with those acronyms. And definitely, like Dustin said, when it comes to the programs that you're interested in, coming out of a Running Start program, it seems like the classes that you're taking at Eastern and the different opportunities that you're looking for, whether it be in physical therapy or the others that the folks here with us are really sharing information about. It's about what you might be doing for those prerequisites and what you're looking to do maybe as a career. So looking into what opportunities lie there. So thank you, Dustin, for sharing that wonderful response.
And thank you, Manny, for clarifying. We get in the habit of acronyms and all that craziness, and I forget that. So thank you very much. I appreciate that.
No worries. It's my job. I'm definitely the guy that gets the questions about what programs are which and things like that. So I'm glad to help. The next question we have is from Betty. She would like to know, what kind of jobs do students go into with a therapeutic recreation degree? And it looks like Emily's going to answer that one for us. Go ahead.
Yes, definitely. So therapeutic recreation is a fairly small profession. So there's a chance that you've never heard of us before. Or there's a good chance you've never heard of us before. Also known as recreational therapy. We are the profession that links recreation with healthcare. So if you look at traditional recreation as being recreation professionals who might work at your local community center or your local pool or your local trail or kayaking excursion group, we are the clinical end of that. So there's a lot of types of areas that a recreational therapist could work in. A lot of those areas focus on blending healthcare with recreation. So just some examples, types of setting on the more clinical end of things. You might have a recreational therapist working at your physical rehabilitation facility. So looking at prior to discharge, returning clients to their recreation and leisure pursuits back in their community and working on their physical rehabilitation goals. You might also find a recreational therapist working at a behavioral health facility or your state hospital where they're working with clients with severe mental illness, working on some of their socialization goals, using recreation again as that modality or that intervention. In the in-between place, you might have them helping clients learn how to play wheelchair basketball post-discharge, but as they're reintegrating back into the community and working on some adapted sports fronts. In the community setting, Spokane Parks and Rec has a recreational therapist that's in charge of recreational activities for individuals with intellectual disabilities. Also in the community setting, you might see a recreational therapist facilitating programs at a camp for children with disabilities or a long-term care facility for adults with intellectual disabilities. So pretty much a spectrum. Myself, my background is forensic psych. So you might see recreational therapy in a correctional setting as well, working with clients post while they're dealing with their charges and also recovering from a mental illness. So there's a wide array in any given class. I'll have a student who wants to work in a super clinical setting and wants to work in a hospital. And at the same time, I have a student who wants to lead backpacking trips with children who might have some at-risk youth backgrounds or behavioral issues. So a wide variety, and you can work inside, you can work outside. It's mainly recreation for special populations, no matter what the setting. So it's a very extensive as far as the settings you can go into and fairly flexible.
Awesome, thank you. All right, our next question is coming from Logan. They would like to know what is public health? And it looks like Dr. Mount is going to take that one on. Go ahead, Dr. Mount.
That's a good question, Logan. And my students and myself, we get that question all the time. It's not easy to define. There are actually 10 essential public health services that guide us in the field. And one way to think about it is that, you know, while medicine is concerned with individual patients, public health is looking at the community as its patient. So trying to improve the health of a population. But like a doctor, that includes assessing the health of a population or diagnosing its problems, trying to figure out the cause of those problems, which often requires, you know, walking upstream to identify the source of that problem, and then coming up with strategies to fix the problems. And public health is focused on prevention. That's a strong piece. While the medical model is typically about treatment, public health is looking to prevent. And so, you know, those 10 essential services that I mentioned earlier, those include everything from monitoring the health status, like I mentioned, but also then informing and educating people in the community about those issues or developing policies to address those health concerns. There's also the ability to the expectation to link with services in the community to address some of these problems. And there's evaluation, which program evaluation is a fantastic career option for students graduating with a degree in public health. It's a field that is not going anywhere. And I often encourage students to look at that field if it's of interest to them. And then finally, research. But that is public health in a nutshell, but I know it seems pretty vast and hard to comprehend, but that's it. Let me know if I can follow up with any more questions on that.
Wonderful, thank you. Yeah,
Can
definitely. Or go ahead, yeah.
Can I just piggyback a little bit? So Dr. Mount that's a great explanation. The way I condense it down for some of our students when they come to me and say, my family doesn't know what I'm going to school for. I think of public health more as community health. So you're not working in a one-on-one practitioner relationship, typically like you would see in physical therapy or occupational therapy or dental hygiene or any of those where you're working one-on-one with your patient. Public health is broader. So you're really looking at community-based health. So you are not trying to just fix one person's diabetes. You are trying to implement a program that will have an outcome for a larger group of people. So whether that means you're implementing health or education or some other resources into a community system, that would affect the community health. And that's really mostly where we see a lot of our public health graduates end up is working really in like health education and health programming. Our very own EWU Health and Wellness Center has multiple NPH grads in it. So the research is a huge part of it, but we just don't get to see that as much here in academia. But we do have our students undergo some of those pieces. So really community health. Thank you.
Awesome, thanks, Jen. All right, our next question is from Caitlin. They would like to know, is the exercise major, I'm guessing exercise science, different from the pre-physical therapy major? And it looks like Dustin's gonna answer that one for us. Go ahead, Dustin.
Yes, it's different. So I'm done, bye. Sorry, actually, so yeah, the exercise science degree is a much broader degree that can go into, and I'm going to ask for maybe Christie to speak to this afterwards. There's so many areas to go within exercise science versus pre-physical therapy. Pre-PT is really designed to set the student up for success and application, and if all's good, acceptance into EWU's physical therapy doctorate program. It includes going through a year of physics and a few other things, excuse me, that really steer you towards the physical therapy aspect of exercise science. And I'm gonna, I hope Christie, forgive me, I'm gonna throw you on the spot, but exercise science is, I mean, it's huge. There's so much involved in what you can do in exercise science that the pre-PT aspect is a very focused area and a very valid focused area. But if you don't want to become a PT, there's like 9 billion different areas of exercise science that are really applicable to people who are focused on the idea of movement as science and growth. So with that, I'm sorry, Christie, to put you on the spot.
That's okay.
It's her.
Yeah, no, and he's right. I mean, you could apply to a physical therapy program and be an English major for that matter. You just have to, take the prerequisites. Within our curriculum, the biggest difference between our students who are just exercise science majors and those who are pre-physical therapy majors is, number one, the GPA that you have to earn in the science courses, so the anatomies and the chemistries and the physics. We do set the bar a little bit higher for our pre-PT, pre-OT students, and I always say it's not because they're any smarter than just students who are just exercise science. Their GPA requirement to declare is a little bit lower. It's just because it's so competitive to get into those programs. So really the only difference between just being an exercise science major and being a pre-PT major is the grade point or the grade that you have to make in your science courses. And then also the pre-PT students do practicum, which is just when you are observing a licensed clinician, and you have to do 200 hours of that for the bachelor's. And then our exercise science students do a 400-hour internship, which is entirely different. You're actually trained by a mentor, and you're taught how to do something, and then you're actually given the freedom to go and do that. So designing exercise interventions or all sorts of things. And just to go kind of off Dustin's point in terms of how big exercise science is, that was actually one of the questions that I think Blake posed. Exercise science is really broad. I kind of presented as kind of like 3 different tracks that you could go into. One is just general health and fitness. So this is working at, for instance, your local YMCA, perhaps as a personal trainer or a coach or a group exercise instructor. I actually did that for a number of years before I started grad school. So, worked with people one-on-one and also had a role in management, and just loved that. So you kind of have a general health and fitness track. And then you also have kind of more of the clinical track, which is your PT and your OT and your athletic training. We also have an increasing number of students who look into chiropractic medicine, as well as clinical exercise physiology. So a great example of that is a person who has like a heart attack, for instance, and they may do a couple of months of cardiac rehab where their exercise is monitored, the electrical activity of the heart, blood pressure, heart rate response, all that stuff is monitored. That's also in the clinical track. And then the other kind of vein that I describe it as is like the performance enhancement. So if you want to do strength and conditioning and work with, you know, collegiate athletes, professional athletes, that's yet kind of another avenue that you could pursue. So I kind of say general health and fitness, clinical, or sports performance enhancement. And I've even had a student who used exercise science as their pre-med major and went on to become an emergency room physician, because it is so heavy in the sciences and the physical sciences. So you can do a lot with exercise science.
Awesome. Thank you to you both. I think just to quickly add on to one other of Blake's questions, they wanted to know if in the exercise science program, if they're taking quarters or semesters. Christie, you can answer that one for us.
Quarters, yep. We operate fully on quarters within the undergraduate program. Perfect.
And I think that's an important question to have posed. So thank you, Blake, for asking it. There are a number of programs that are semester-based within our College of Health Science and Public Health, and others that fall under the quarter-based system. So for those that might not know all the details, quarter-based system, we have the 3 fall, winter, spring, and then summer, of course. If you're interested, and like we already saw from Dr. Mount, sometimes it's a really good opportunity to take advantage of those opportunities during the summer. But others are split into 2 semesters. So you'd be doing a fall and spring semester. If anyone wants to correct me if I'm wrong, I think that is the breakdown of how they go. But they just look a little differently in terms of the dates and times and the sizes as well. So I think Dustin has something to add.
So the only programs, forgot my mic, sorry, I apologize for oil. The only programs that are really focused specifically on the semester schedule are dental hygiene, communication sciences and disorders, health sciences, specifically health sciences, the online program. Everything else is, and then we have our nursing program, but that is a consortium agreement with WSU. So other than that, the quarter system is really what we want to focus on.
Terrific, thank you for that. So going right on to our next question, William had a question asking what resources are there for students with mental disabilities? Great question, William. And it looks like Dr. Hazel Baker wants to take that one on. Go ahead.
Yeah, and I may not be the best to answer this. I'm looking at admissions and the other folks on campus. What I will say is Eastern's got really solid programs in order to help those with disabilities coming in. We've got disability services that help with everything from testing and testing, setting up, working with professors to get any particular accommodations that are needed to get through classes. Mental health, mental wellness is a huge push in colleges right now, and Eastern has embraced that and have been doing trainings with faculty, with staff, across the board to be able to take care of ourselves, but also help students and find appropriate outlets for students, working through what services they need, what's available, and how we can help. There are more changes coming over the next year. I've been privy to some of the inside conversations on those things as far as services go. And it's kind of an exciting time to be in EEG because we're embracing those things. So disability services there to help with anything that needs to come in as far as helping students out to navigate this new world of college.
I would just add on to that, if I could, that Eastern just recently connected with the JED Foundation, which is an organization that we now have a relationship with for the next 4 years that is helping us to identify the needs of our students in terms of mental health. And it's a really broad look at everything from what's happening on our campus physically in the built environment, what social opportunities do we have for students. It's a pretty impressive program that they're taking us through for the next 4 years. And so I'm very optimistic that we will be outstanding in this area in the future.
Awesome. Thank you for sharing. Wonderful news for sure, and all the great things that Eastern is doing, particularly in our College of Health Science and Public Health. So wonderful to hear about all those great advancements. Our next question coming right in is also for Dr. Mount, so a good segue. Betty wanted to know what classes would be taken for a public health degree.
Okay, I'm going to share my screen again because I think it would be helpful if that's okay with the admins here. So I thought this might be easier. Take a look at this. And I'm getting, let's see. Okay, screen up. Can I get a thumbs up? Screen's up? Great, okay. So this is the program. These are the courses in the program. You can find this on our website, and you can, click on the link and it'll give you a brief description of the course. But it starts with an introduction to community and public health, which is essentially providing an overview of the subsequent major topics, such as epidemiology and health disparities, environments for health class. We have our program planning and program evaluation class, 440 and 450. That's really one big class that's split over 2 semesters, where we conduct a needs assessment and then design a program plan. And then in the fall, we learn how to evaluate that program. We implement aspects of it. And we also create social media and social marketing messages to try to change behavior around the program plan and the research that we have conducted. I mentioned earlier about the service learning, and we have grant writing as well. And we have the supporting courses, which includes Biology 234, which is part of our anatomy and physiology series. Biology 232 and 233 are prereqs for the program, prereqs for declaring the program. However, some students don't have that in their background, and we don't want to hold them back from starting the program. So it is possible to simultaneously enroll in Bio 232, which is the first course in the series, and at the same time register in the fall courses, which 370 would be one of them, the intro course, as well as the health disparities course. You can get those going at the same time, and that would be fine. And then you just end up declaring at the end of that first year.
All right, thank you, Dr. Mount. Next question we have is from Jennifer. They would like to know, they're taking prerequisites, but is there any shadowing opportunities for the dental hygiene program? Where could they go for these opportunities, and is there an amount of hours you must do? And it looks like Dustin's going to answer that one for us.
Up until, a month ago or so, yes, 40 hours, that was a requirement. As we sit right now, because of the requirements for stay at home, stay safe, we are mitigating those opportunities. And so I'm sorry, I don't have a answer. However, Casey Clark is the admissions advisor for the dental hygiene program. So that's Casey with a K, Clark with a C, and she's very, very helpful in helping students figure out how to move through this current situation. We are all dealing with something that is very unique, and with that, we are making unique opportunities. So that's my suggestion. I will type in Casey's email here in the chat in just a moment, And with that, she's probably the best person to talk to about these opportunities.
Awesome. Thanks for sharing, Dustin. Blake is back at it again with the wonderful questions. Thanks, Blake. He would like to know, he's wanting to share he's a transfer student coming in as a sophomore and wanted to know what classes should he start off with for exercise science. Go ahead, Christy.
So to declare as an exercise science major, again, you need those 2 sciences. And so not really certain what you will have under your belt when you come in as a sophomore, but either the human anatomy and physiology series or the chemistry series. And then once you have those and you declare, you are paired up with one of the exercise science faculty advisors. There are 4 of us that advise, and we will sit with you and map out your next 2 or 3 years at Eastern, and let you know what you need to take and the order in which you need to take it. But the first step would just be to declare with the science courses.
Awesome. Thank you. Our next question is from Piper, and they would like to know, is it a good idea to jump into pre-health classes before EWU's backer courses, or to take a mix? Anyone has any suggestions about that? Really quickly before anyone comes to answer, the backers are some of those like prior courses that students are getting in that involves with their degree. So they're wanting to know if they need to have any of those done before, or they should have a mix. It looks like Emily has a response for that one. Go ahead, Emily.
Answer that one as it's kind of general to all of us. It depends. I would say research the program that you're looking into. So I know some of the programs have some of those prerequisites embedded in them already. So we Therapeutic Recreation, our program is also a feeder to OT graduate programs. And so some of those prerequisites are embedded in our 2-year program. So you would take all of our classes junior and senior years, and in that process, you've knocked off quite a few of those pre-OT prerequisites. And so then some other programs may not have them embedded in the curriculum. So kind of just look and see which bachelor's route you want to go. Some have them embedded in their curriculum. And then in that case, you would want to hit those backers first, those general ed classes initially. And then once you hop in, you can take those major specific courses, which may also kill 2 birds with 1 stone.
I'd like to add to that. The direct transfer agreement is pretty powerful from different colleges across, especially across Washington and then the rest of the university, or sorry, rest of the of America. So taking a look at how those courses meet our gen ed requirements is pretty important, because there's plenty of degrees out there that meet those gen ed requirements, but also don't meet our program requirements. So like Emily said, pay attention between the 2, because you may have a program that meets all the university's general education requirements. However, you're not meeting the requirements of the degree. And so there's a bit of a, I mean, it overlaps, but it also kind of overlaps, right? It doesn't quite meet the same standards. So stay in contact with either your car advisor or your faculty advisor to make sure that those programs meet the requirements of graduating from Eastern and graduating with a degree from Eastern.
Awesome. Thank you to you both. One of the things I wanted to share with students that have been asking some wonderful questions, if you didn't by chance hear your question answered live, it probably is in the answered section. So remembering to scroll through our answered section, there's a lot of wonderful responses from our panelists here with links, folks to contact, people to reach out to, and ways to get more information. So do not fret that your question might not have been answered live, or if it suddenly moved, chances are it's there in the answered section with a wonderful response waiting for you to check out. And we have just about a minute left in our panel. I did want to close with maybe one last question for the whole group, they want to give a short response that I know we always like to talk about, what sets Eastern apart. So the question is, why should students choose Eastern to earn their degree, maybe in your respective field or the department or program that you work in?
Rec is awesome. That's all I got.
It sounds like a sales pitch. It may sound trite. It's an affordable education, right? When you look at what expenses are across the state. And we just have some pretty amazing professor staff that we get to work with. One of the downsides of the COVID and being online for this quarter, we haven't seen each other's faces, and there's some amazing people doing amazing things on campus. You may look at a smaller regional directional and wonder about the research or wonder about the teaching one. You don't have to wonder at Eastern. We've got some phenomenal scholars doing world-class research and some phenomenal teachers who deeply care for their students. Our students refer to most of us by our first names. We build relationships over the 4 years on campus, 4 to 6 years on campus. And I think that's the heart of the regional directional institution like Eastern is. We're all in this together and working together with some pretty incredible people.
Yeah, to build on what Chadron was mentioning, I would say that it's really the passion that we bring to teaching and the passion we bring to the classroom. So any of the faculty that you'll be working with at Eastern are there not just because we enjoy working in academia, but also because we enjoy being in the classroom. And so for us, that's first and foremost is not just the research and our passion for the content, but our passion for teaching and passion for conveying that content to our students. And you can really see it in all of the faculty and the fact that we put our students first.
I would point out for public health that, the healthcare sector is by far the fastest growing industry in Spokane County. And you combine that with our program that is committed to making connections in the community and making sure that students have the opportunity to work with community partners, and a smaller cohort size, and well, just a cohort model in general, I think is a real plus for a program.
Awesome. I'm glad that I was muted for a second there. I was going to cut in and I realized I was muted. So I'm grateful that I was muted in that moment so that Dr. Mount could share that last little bit, and to all of you for sharing as well. I think very poetically, right? I like to say that was a wonderful bow to the gift that was all your knowledge, all your expertise, your authenticity, and the wonderful information you shared with our attendees today. And with that, I want to say thank you to all our panelists for all their support, all the great information that was shared, and to you, our attendees, for participating with us, asking wonderful questions, taking the moment to sit with us and chat and learn a little bit more about the College of Health Science and Public Health. So with that, I want to say thank you. Thank you again for joining us, and hope everyone is well. Take care.